Hello students, welcome to chapter 17. We are talking about patients with allergies and immunity conditions. This is HIV part 3, final part. Okay, let's talk about gas exchange facilitation. So for patients in stage 3, let's remember stage 3 are those patients with a CD4 T cell less than 200, right, with opportunistic infections. Prophylaxis against pneumonia Girovici is often used. So here we go. This is a medication that I'm going to test you about is trimethoprim with sulfamethoxazole is used prophylactically as well as for treatment of this disorder. Usually this drug is well tolerated. However, because trimethoprim inhibits potassium and creatinine in the renal tubules, careful monitor renal function and electrolytes. And that's good to know. I also want you to monitor liver enzymes, hepatotoxicity, and platelets, okay? So there is an article here from the National Institute of Health, right? Let me see if I can open this to show you. Yes. Okay, so life-threatening thrombocytopenia, so it's the platelets are going to be low secondary to trimethoprim sulfamethoxazole. Okay, so basically this is the article that you can have access in the National Library of Medicine from the National Institute of Health. Okay, so it's there. It's going to stay there for you to review if you want to expand on your knowledge. So for this particular combination of medications, trimethoprim and sulfamethoxazole, just double check potassium and creatinine and also the liver and the platelets. Okay, I want you to know that. Okay, assess the respiratory rate, rhythm, and depth. Of course, it's a pneumonia, breath sounds, and vital signs at least every 8 hours, right? At least every 8 hours. So if you can monitor that every 2, every 4, much better. Monitor mechanical ventilation, perform suctioning and pulmonary hygiene, and evaluate blood gas results. So rest and activity changes are needed when gas exchange is impaired. Oxygen might be ordered. Sometimes bronchodilators will be ordered to improve airflow, and glucocorticoids also to reduce inflammation. So pain management. Patients in stage 2 may experience peripheral neuropathy from drug therapy or disease progression. So we have to monitor that. And then some states recognize stage 3 as a qualifying eligible condition for their state medical cannabis program. Okay. Nutrition. Patients in stage 3 may experience numerous GI complications, including anorexia, nausea, difficulty swallowing, and decreased GI absorption. So AIDS wasting syndrome, also called HIV-associated wasting syndrome, is in which patients unintentionally lose 10% of more of their body weight and lean muscle mass and have reduced physical endurance. So here we have a picture of oral candidiasis, right? Just let's remember that the difference between candidiasis and leukoplegia, remember, is that in this case you can scrape off this white part and it's gonna go away. In leukoplegia you cannot do that. Okay. Sometimes the cause is visible, such as when mouth ulcers, oral candidiasis thrush, And Candida esophagitis makes swallowing difficult, thereby reducing intake of food is going to be more comfortable for the patient. Systematic fluconazole is usually instituted, and brushing with a soft toothbrush should take place several times daily. If stomatitis is related to dentures, brush the devices vigorously and soak them in chlorhexidine gluconate before returning them to the patient. So the registered dietitian nutrition can assist with meal strategies in which a high protein, high calorie plan is usually instituted. Remember that this patient unintentionally is losing about 10% of the weight, right? Easy to swallow foods will be recommended for patients with mouth ulcers and esophagitis. Supplemental vitamins and fluids are indicated in some cases. Remind patients to avoid consuming raw or rare fish, fowl, or meat. To thoroughly wash fruits and vegetables, and to properly refrigerate foods to minimize the chance of acquiring a foodborne infection. So for the patient who cannot achieve adequate nutrition throughout food, enteral or parental nutrition may be needed. And that's good to know. High protein calorie for Candida esophagitis, okay? Remember, high protein and high calorie for Candida esophagitis. In certain cases associated with AIDS, wasted syndrome, somatropin may be ordered. This drug, a recombinant human growth hormone, can improve lean body mass, body weight, and physical endurance. It can only be given if the patient is HIV positive. Somatropin can only be given if the patient is HIV positive, has a diagnosis of HIV wasting syndrome or cachexia, and is taking antiretroviral therapy. Okay, here is a picture of a patient with Kaposi sarcoma. We learned about this also in previous chapters. And you can teach patients how to administer these daily subcutaneous injections at home. Of course, we are talking about the somatropin, okay? And teach how to rotate injection sites daily, such as the arms, the legs, or abdomen, and to administer this drug to themselves before bedtime. Clarify common side effects, which may include swelling of the hands, somatropin, okay, giving only when the patient is HIV positive, and we have to rotate the subcutaneous injection like we do with insulin, right? And common side effects may include swelling of the hands, feet, or eye orbits, bone muscle and joint pain or stiffness, tingling or numbness in the hands, strange skin sensation, breast enlargement in men, and fatigue. Now we are going to talk about managing diarrhea. Patients in stage 3 often have persistent diarrhea related to any one of the opportunistic infections or drug therapy. So it's either the opportunistic infection causing the diarrhea, right? The causative agent could be viral, bacterial, or fungal, right? Or parasitic. Or is the medication, one of the other. If ordered, administer antidiarrheals as prescribed. Assess the perineum regularly. Keep this area clean and dry, and collaborate with a wound care specialist for interventions to manage anal excoriation and discomfort. Report even small changes in this region, such as the development of a pimple. Also, preserving skin integrity. Impaired tissue integrity can occur due to Kaposi sarcoma of the skin, and Kaposi sarcoma responds well to antiretroviral drug therapy, and many lesions disappear over time. Also, management of painful Kaposi sarcoma includes analgesis and comfort measures. Keep open weeping Kaposi sarcoma lesions, and clean and dress to prevent infections. Many patients with Kaposi sarcoma are concerned about their appearance and the association of these lesions with being HIV positive. Recommend clothing options such as long sleeve shirts and pants or hats, as long as lesions are not open. That may help the patient feel more at ease. So another cause of impaired tissue integrity is skin infection with herpes simplex virus or varicella zoster, the same family. For the patients with herpes simplex outbreak, keep the area clean and dry, and remember the varicella zoster virus is a painful condition that requires analgesis, assistance with position, and other comfort measures. Drug therapy for herpes and varicella includes valacyclovir, famciclovir, and acyclovir. So that's something that you need to consider. Then there are multiple complementary and integrative therapies, herbal, supplemental, homeopathic, care coordination and transition management also needs to be considered. Home care management, basically it's all patient education, self-management. Here there is another interesting table talking about patient and family education, infection control for home care of the patient in stage 3 HIV. The direct care, follow standard precautions, use new clean gloves each time. In terms of housekeeping, wash dishes, prepare a disinfectant. So here is one by one mentioning how to take care of the patient in home care, and you can read especially in stage 3, right? Because the CD4 T cells are very low, it's less than 200. So you need to be careful. The patient needs to be careful and needs to take very specific precautions. There is also information about healthcare resources, right? And you need to ask for the doctor to give you referrals for home IV therapy, community mental health, behavioral health agency, meals on wheels, right? Very important. And at the end, when you evaluate all the therapies, education, and medications that the patient is considered into for the treatment of HIV, you are looking for desired outcomes for care of the patient with this condition, and these are to maintain the highest possible level of function and quality of life for as long as possible during the course of this chronic condition. Expected outcomes include that they will be adhering to the prescribed drug therapy. Remember that if they don't follow the drug, they can resistance can develop, and this is very bad for them. To practice safer sex and maintain a self-perceived high quality of life by refraining from spreading the HIV virus to others, avoiding acute infections, and avoiding development of opportunistic infections. And with this, we have concluded the HIV part. And when we come back, we are going to talk about Lyme disease. We are still covering all concepts of chapter 17, and just be patient. It's a very interesting chapter, many conditions that we need to cover, right? It's a long chapter, but we are in this learning process of nursing. Okay, when we come back, we will talk about Lyme disease. Thank you.